Health Now is sponsored by Try Health.
I haven't heard about bariatric surgery for a while here, but apparently it's becoming an increasingly common option for people living with severe obesity, especially when diet, exercise, and medication have not produced any kind of lasting results.
Supporters say it can dramatically improve health, while experts stress it's not a quick fix. In today's Health Now, Fox 19 Now's Dan Wells takes a closer look at this.
For many patients struggling with obesity, bariatric surgery can be a life-changing procedure.
There's a lot of factors that go into play in terms of who should proceed with surgery versus medical options to treat obesity. The most important thing is patient preference. Patients have to be ready and willing to undergo surgery. The other things that we look at in terms of who's a candidate from a medical perspective includes the BMI. BMI is a simple calculation looking at height and weight, does not take into account anything else, just height and weight, not muscle mass, not fat composition. And so is it a perfect marker for obesity? Not necessarily, but it is what we use. So a BMI over 40 with an associated obesity-related disease. The most common ones that we see are high blood pressure, high cholesterol, diabetes, sleep apnea, heart disease. Those are all diseases that can be helped by treating your weight.
Doctors like Katie Meister with Try Health also emphasize surgery works best alongside long-term lifestyle changes.
Not just doing a surgery. It comes with a lot of education, a lot of support. So all of our patients see our dietitians every month leading into surgery to start the education process. If we just do surgery but don't educate patients on how to eat or how to exercise, we're really not doing them any favors. Obesity is a lifelong chronic progressive disease, and it's going to take the rest of someone's life to treat that disease. Surgery is not a cure. So if we just did surgery without tackling the mental aspects, the dietary aspects, the physical aspects, then it's not going to work.
Meanwhile, new research says the number of bariatric surgeries performed in the United States declined in 2024, even as obesity rates remain high. Researchers believe the growing use of GLP-1 weight loss medications may be influencing treatment choices, though experts say surgery remains one of the most effective options for eligible patients.
Honestly, the biggest misconception that we hear is that bariatric surgery is not safe. And that is absolutely not true, is that the risks of having a major complication, including a leak or requiring a blood transfusion, is less than 5%. The risk of mortality with surgery is less than 0.1%. So these surgeries are just as safe as getting a gallbladder or having a hysterectomy.
Well, doctors recommend anyone considering bariatric surgery discuss the benefits, the risks, and long-term commitments with a qualified medical team to determine whether it's the right option for you. For more information, go to tryhealth.com. Dan Wells, Fox 19 Now.